Welcome to Unit 4, Short-Term and Long-Term Health Effects. By the end of this unit, you will outline the short-term and long-term health effects of air pollution. Let's start by defining what we mean by short-term and long-term exposure to air pollutants. Short-term exposure means hours, days, and weeks. Long-term exposure is months and years. Short-term exposure to air pollutants has been associated with chronic obstructive pulmonary disease, or COPD, respiratory illnesses, higher rates of hospital admissions or medical visits, and all-cause and specific cause mortality. Long-term exposure to particulate matter has been associated with the onset of cardiovascular and cardiopulmonary mortality, lung and heart disease, lung cancer, as well as poor mental health. These causes of death and disease have been associated with other pollutants such as nitrogen dioxide, carbon monoxide, and ozone. Exposure to PM 2.5, nitrogen dioxide, and carbon monoxide during pregnancy has been associated with adverse pregnancy outcomes, with health consequences for individuals throughout their life cycle. The burden of morbidity and mortality from air pollution, estimated in epidemiological studies, is higher at the population level for long-term exposure than for short-term exposure. This demonstrates that long-term effects are not merely the sum of short-term effects. While in the past, researchers were focusing their attention on the short-term effects of air pollution, this changed considerably when it became clear that long-term exposure to particulate matter has a much greater effect on human health than short-term exposure. You can download the reading materials to get more detail on the associated long-term and short-term health effects of particulate matter, nitrogen dioxide, ozone, and carbon monoxide. You have now completed Unit 4. In the next unit, we will look at the populations at higher risk.